Hi there, I'm Dr. Andre Williams. I'm a consultant hematologist oncologist here in beautiful Montego Bay, Jamaica. And I'm here to tell you a little bit about my journey. I started my journey as an oncologist in 2012 when I completed my postgraduate training. And at that time, I was so excited about being able to make a contribution to my island. Over time, though, I began to realize that there was so much more to cancer treatment than just giving the usual standard modalities that were used to the chemotherapy and radiation. And so I began a journey that I didn't realize I was on, seeking other options to effectively treat cancer for patients who either did not want the given options or who were trying to find alternative treatments that worked. And so that took me on a quest to find out, was there anything else available for patients across the world? What were other countries doing to try and find out what could be effective for their patients? And the more I researched, the more I realized there were other things out there. So I got exposed to the Gerson therapy coming out of San Diego, California. I got certified as a Gerson therapy practitioner. And my whole journey began at looking at how nutrition and supplements and changing lifestyles could assist patients with cancer and other chronic illnesses. I actually won an award along the way. I won an award from the American Society of Clinical Oncology for my work in a developing country, which was a really nice opportunity for me to be exposed to the other countries in the world that were trying to use treatments that were effective but yet affordable. Ultimately, my journey led me to the Gonzalez Protocol as I began to read about the work of Dr. Nicholas Gonzalez. From the very first time I encountered this protocol, I was already impressed. I loved how all-encompassing it was. I loved the fact that there are individualized treatments available for each patient. I love the fact that the different options related to the patient's unique metabolism as well as their autonomic nervous system, everything is incorporated into a beautiful, nice package that allows each patient to get treatment that is tailored to them. And with that, the results are always so reproducible because it's so meticulously organized for each patient. And it was greatly disappointing for me to find out that he was no longer around. I immediately wrote to the Gonzalez Foundation, asked if there was any way I could be trained in his protocol. At the time, it was not possible. But I was so excited in 2020 to get an email in my inbox saying, would you still be interested in being trained in the Gonzalez Protocol? And of course, I immediately said, yes, of course I would. And I jumped at the opportunity. I was selected to be a part of the training program, which took place in 2021 summer. It was a rigorous program because, of course, we had to revisit everything that Dr. Gonzalez had meticulously crafted over the years and try to understand it and comprehend it all in an attempt to build on it. And so I'm happy to report that today I'm one of the 7 Gonzalez Guardians worldwide, and my particular interests are cancer and autoimmune illnesses. Naturally, cancer was my core specialty and continues to be, so I'm excited about working with cancer patients, but also autoimmune illnesses I find are particularly rewarding to treat, and I enjoy helping people with these illnesses. So I want to challenge you, if you think in any way that you may benefit from the Gonzalez Protocol, you need to visit www.thegonzalezprotocol.com. There's a questionnaire there where you can find out your own metabolic type, spanning a spectrum of 7 metabolic types that Dr. Gonzalez developed. And you can find out if the Gonzalez Protocol will be suitable for you. Who knows, you may even end up working with me as your Gonzalez Guardian, and you'd get to come to beautiful Montego Bay, Jamaica, where my wellness center is based. So guess what? I've said enough. I want to encourage you to check out www.thegonzalezprotocol.com. See the information there, decide if this is right for you, and we'll talk later. Bless you.